In extending tertiary healthcare in a smaller town. Durgapur, though not a small town, but in Calcutta, as you say, that much of the activities happen in Calcutta and the peripheries are always underserved. So he is running a big hospital in Durgapur, and in fact, not only serving the Durgapur, but lot of peripheral areas in the Jharkhand also. So I request his sharing his experience, opportunities about the providing accessible healthcare, that too in super specialty stream in tier 2 cities of West Bengal.
Very good morning to all of you. Dignitaries on the dais, off the dais, who are sitting in front of me, and all of you, my friends. Well, my thanks to CII to give me this podium. First, I start with a comment. I would have believed Dr. Dilip Josh a decade back. Yes, super speciality can only be in metros. But my basic question is, look at the state of West Bengal. 9.5 crore population, 1.5 crore in Kolkata, and 8 crore out there fighting for themselves, rushing to whatever healthcare they're having to rush for. I would love to start with an anecdote. 2nd April 2008, we had first started a super specialty care outside the reams of metros. At 10 p.m. at night, that was the inaugural day of the hospital, we get a patient 45-year-old in the emergency who had a massive heart attack, pulses, blood pressure not holding. We had to roll the patient to the cath lab. All of you, the cardiologists sitting over here, know that he had a totally occluded, 100% occlusion of the main coronary artery. On an IVP machine, we did a primary angioplasty, that is, we opened up the artery. That was 2008. The gentleman was 45 years old. Today is 2022. He has retired from job and still visits my OPD. This patient would have died, by no way would have reached Kolkata, no way would have been within the reaches of any super specialty healthcare anywhere, had not that damn hospital been opened there that day in that city. That was the first time when we started thinking that yes, super specialty can go outside the metro. All said and done. After that, it got established, yes, the Mission Hospital was the name, and I was the founder director of Mission Hospital. After that, time moved on. I got a scope offered to me by none other than my legendary inspiration, Dr. Devi Shetty, to start the cardiac services in the then Narayana Rudwala IQ City Medical College, Durgapur. We laid down the cardiac services there. After that came the Healthworld group. Came 3 medical colleges, Shanaga Hospital, IQ was already there, Gauri Hospital added up. In Shantiniketan, you have a medical college now. And Durgapur is Asansol, Raniganj, and that area is developing into the 2nd medical hub of the state. Well, it can be done if we shut our eyes and say that no, this is the way we think, that we think in metros. We stop here. We have to go to the 8 crore. We have to decentralize all aspects of healthcare. The primary responsibility of the government is private healthcare. The government is doing whatever it is, whatever possible under its reins. The rest part, we have to go forward. Now, where is the problem? Where is the problem that people do not invest in the tertiary healthcare there? Well, you know, like in all other countries and in our country itself, the access to healthcare is limited to the metros for the simple reason. The amenities of living here are good, the education scope is good, You get good cafes out here. You can spend a good evening. You can go to a theater, have a good show. That is not there in the peripheral cities. So that is why most of the doctors, most of the healthcare professionals, being class A workers, do not want to spend time there. Second, recognition. You do a boiler operation in Kolkata, it will be in the first page of Anand Bazaar. And you do an ICD in Bolpur, it will be in the last page, 3 lines, in the district page. Our concept is that other than Kolkata, nothing can exist. We have to come out of this. We have to give respect. A guy who is qualified enough and doing services at any levels, so he has to come forward. When he will get recognized. So basic recognition is needed. The challenges are 3. Infrastructure is no challenge. You give money, infrastructure comes out. The easiest way to do. Investment, no challenge. Lot of investors are there. The major challenge is manpower, affordability, and number 3, our thought process. Manpower, already the government has taken very positive steps opening up medical colleges, and as Dr. Shetty has stated that the medical college laid down, nursing college laid down has to be simpler. We'll give you a solution to this. Affordability. Here I must mention one thing. The question of affordability has been swept at one shot by one unique venture, the Swasthya Sathi card. Yes, guys, we have to accept that the card is going to stay, and card will be the tomorrow of management of healthcare, if I am not overstating it. I do accept it requires some tweaking here and there. There needs to be restructuring. But remember one thing, no beginning can be perfect. But there has to be a beginning which ushers a new thinking in healthcare. So that has been taken care of. Now, a few things we all know, a bit of tax holiday there, a bit of easy manpower there can be added to it. And if half of what I am thinking can be put in, I would love to have an interesting tomorrow. Before I end, being from the doctor fraternity, one alarming thing is happening that has to come to a stop by the government and by the legislation. The attack on the healthcare has to stop at any cost. It has to stop at any cost on the healthcare workers, because that is the primary thing which will not allow us to expand. All of things that we are speaking over here will come to a dead end if we do not carefully look into it. It is gradually developing into a pandemic. Thank you for patient hearing.
The session has